children and young adults who die of sudden death from cardiovascular cause, the most common reason, if you look at all the public literature, is unknown. Far and away, a third or 40% of the cases, there's no known diagnosis. And it could be that they didn't have an autopsy. There are many places in the world where that's just not available. And it could be that the autopsy was done, but they only had enough resources to look at a tiny bit of the heart, and they missed the part of the heart that had myocarditis. Because it's not usually the whole heart. It's a tiny little bit of the heart. But if you look at the patients who died, who had diagnosis, the most common reason is a genetic disease, hypertrophic cardiomyopathy. And this disease has a number of treatments that are specific. And the phenotype, the enlarged walls of the heart, can be seen by an echocardiogram or an MRI. Very different than myocarditis. This can be diagnosed in the community with a handheld echocardiogram the size of this laptop or smaller. You can take this into rural Appalachia or Vietnam or China, and you can make a diagnosis with reasonable accuracy, which is not currently possible with myocarditis. And the second most common reason are abnormal origins of the coronary arteries. If you see, in the normal heart, the coronary arteries come off the aorta, but in some children, they're born with anomalous coronary arteries, and that's actually the number 2 reason, and that's treated surgically. And again, this can be diagnosed with common imaging, like a CT scan or a coronary angiogram, clinically available tests at many hospitals in the world, and it's treated by cardiac surgeons in a standard fashion, and in many cases. And again, very different than the problem that we face in this room today. The disease we're facing doesn't have an easy diagnostic test that can be used in the community, and it doesn't have a surgery in many cases or a drug that is specific for the disease. And therefore, device companies and drug companies are not interested because it's not really in their business interest to fund a lot of research that they will derive no benefit from. That doesn't mean that's going to be the case in the future, right? 10 years from now, hopefully, the people after us will sit in this room and be saying, wow, I'm so glad they worked on this problem, because today we have the diagnostic tests we can use. To focus on sudden death, because many people in this room have lost loved ones to myocarditis, statistically it's about, if you look at autopsy studies of young people, about 2% of infants, about 5% of children, and somewhere between 4 and 20% of young adults, less than 40, die of myocarditis. That's statistically the way it falls out. In every case series, men are more likely affected than women. And the reasons for that are largely unknown, and Delisa Fairweather and Lori Bloat, who's sitting here, if you haven't met Delisa, she's in the next room. I hope you will take time to meet her. I'll show you her picture in a moment. Are trying to sort out the reasons, using a multi-center international registry, why it is that men are disproportionately affected, because there may be sex-specific therapies which can be beneficial at minimizing that risk. And as I mentioned, what is sobering and tragic is that 40% of these young people who die have a structurally normal heart. That if you just look at the heart, it's a normal size. It's a microscopic or a very small abnormality that led to the arrhythmia and the sudden death. So this is Delisa Fairweather, so you can identify her in the next room. And I show this picture in the laboratory where she's working on patient samples, because one of the key things of her research and all of the collaborative research we do is that it not only does it involve mice and laboratory techniques which are cell-based or addressing fundamental science questions, they also include patient samples. So patient's blood, patient's heart tissue, in some cases autopsy heart tissue, she uses to figure out these questions to make sure that the observations that she makes in the mice are relevant to people. There are many models of disease which are actually not that relevant. They teach us about mechanisms, but they don't teach us how to make people feel better and live longer. And that's the goal of this research. And my last slides are really just to say inflammation in the immune system is often a hard concept for doctors and for people in general. And the immune system is meant to help you protect you against infections such as bacteria and viruses, and to prevent cancer. Those are the two things, and it maintains homeostasis. So we all have a pretty stable number of white blood cells because, except when we have an infection or inflammation, because of this homeostatic mechanism. They're very strong forces which keep the immune system in balance. It upregulates when there's a danger signal, and it goes right back down as soon as the danger signal's gone. This disease, myocarditis, is a heart-specific immune reaction where it doesn't downregulate. The damage keeps going. And that's why we focus on the regulatory mechanisms, not just how does this damage happen, or the key question is, what was the trigger? How many of us have asked, what caused this death? What caused this injury? What was the first thing? In people, you can't get back to doing archaeology to that first moment. And it's terribly frustrating. I wish we could. I've asked hundreds of people, hundreds of scientists, can you get back to that first injury to know what it was? And by the time the heart damage is done, it's just like the end of World War II. Everything's been destroyed, and all you see is the ruins of what used to be there. You can't work back effectively, at least not today. But what we do know is that if you catch it, you can downregulate. You can, today we have tools that are available in people to return the immune system to balance. And so I finish with this slide just to say it is a balance. You need your immune system to be healthy. You need it to protect against infections and cancer. When it gets out of line in a way that it causes severe damage, it needs to be suppressed, if possible, in a very specific way, so that you don't have global consequences to that. What can we do? What we do as a foundation is three things. Our number one mission is to help people who've been impacted by the disease, patients, their families, their parents, their brothers, their sisters, their spouses. Number two, we educate. We educate the public, and we educate physicians and caregivers. And we do that through our meetings, through our websites, through our pamphlets, through our mailings, and through the talks. And finally, we promote research. We support research worldwide. In the next room, 13 of the people we've given grants to are presenting their research, and they're learning from each other. Not only do we give money to young people in a targeted way to develop a career interested in studying this for the next 30 years, we give the seed money to start them, but we give them the environment to grow, so that when they finish their year of funded research, they have all the other people in the next room in their Rolodex. They can call them, they can look to them to support the senior people they can look to find jobs, and they have a lifelong structure that like the soil in a garden and the water, keeps fertilizing and keeps them alive and interested. Because if you just give them the 1 year and they go out there, they'll go on to something else. What can you do personally? My appeal would be support the foundation in a way that you feel comfortable. If it's financially, that's great. If you could give an awareness event, we are very supportive. Our board members are delighted to come and support you. We have the Not a Blank poster, Not a Blank canvas posters, which go out. We have 3 sets that go out all the time to people worldwide. And Candace and Lori, I'm going to stop there. Is there anything more specific or additionally that you want me to add?
No, I think it would be important for you to see if they have questions for you.
Oh yeah, absolutely. No, I only gave a very brief overview. And I should say I give about 20 to 24 talks a year on myocarditis, and I always finish with this slide. This is, and I always bring the information wherever it is, always hand it out, and hopefully inch by inch, little by little, and I know Lori and the other speakers, the other board members who give talks do the same thing. We will impact slowly but surely the global perception of this disease. For example, and we partner strategically because we're a very small organization. We partner with people like the Heart Failure Society of America, where there are 3,000 or 4,000 physicians here. We could never attract 4,000 physicians to a myocarditis meeting, but they're out there in the hallway right now, and we're holding a meeting with all of our literature in that big room across the hall, up and down the halls. We have our posters lining the walls because they can't not walk past them. So that's how we get the word out, is we capitalize on these relationships. We'll do the same thing in Australia next year, and we'll be back here hopefully in future years with this. They're a wonderful partner group. So please, if you do see people from the Heart Failure Society of America, let them know how appreciative you are. They gave us a lot of support to put this on. And I'll take any questions.